The question now becomes, how is Eli Lilly going to make up for significant patent expirations that are coming down the pike? So let's bring in analyst Tony Butler, who's very familiar with Eli Lilly. Tony, welcome to the program. Give us your take on this news from Eli Lilly. How damaging is this for the company going forward?
Yes, thanks, Suzanne. And in fact, let's be clear. Alzheimer's disease and strategies to mitigate or improve cognition in patients who have Alzheimer's disease is very, very risky. Lilly has had two programs. One, as you mentioned earlier today, has failed. Again, a very risky probability of success. Their second program is also an antibody, actually, that targets some of the problems that occur in patients with Alzheimer's disease, and we don't know that outcome. So, if you will, it puts a great deal of pressure on the probability of success for that program, as opposed to simply having two opportunities in the marketplace. Now, let's just stop for a minute.
But Tony, I don't want to interrupt you, but if the second drug is in danger now, what does that say for Eli Lilly's growth story going forward?
Right, and that's a fair question. It's just that I'm not sure it's in danger, because I wouldn't make the leap that says that this failure in this particular trial actually suggests there'll be a failure in the other trial. They're two different compounds. They're different mechanisms. I'm not saying they're both not terribly risky, and certainly everyone on Wall Street assumed that there would be a risky endeavor. But let's assume this occurs. Let's assume the other program fails. It puts increasing pressure on revenue growth in the outer years for Eli Lilly, especially when a number of patents are expiring. But it's not the only programs that they have. They do have some mid-stage trials in other areas like rheumatoid arthritis, which are very exciting, but it does put increasing pressure on revenue in the near term.
Okay, Tony, quickly, do you own the stock today? Do you buy on the weakness?
We don't own the stock today, and candidly, we're neutral to stock. We would avoid it at the moment.
Okay, great. Our thanks to Tony Butler, pharmaceuticals analyst at Barclays.